stream for mental health care earlier, and man, I am so grateful and so um, I'm so impressed by her and the effort she took to do such a thing, and that's really great. And a lot of people were giving testimonies, and most of the testimonies were about like what sort of like counseling and therapy and what sort of like support systems were in place, and those are all very important. It is probably more important than medication, but I was just going to add, because medications, antidepressants, antipsychotics, Ritalin. I'm not a doctor, so I'm not very good with all the terms, but yeah, basically all these sort of drugs for mental health care. Those mental health drugs have a far greater stigma attached to them than therapy. I mean, don't get me wrong. There's already a bad enough stigma attached to therapy, and a lot of people are very reluctant to say like, "Oh yeah, I, I'm going to see a psychologist." You still get people saying like, "Oh, I don't want to see a shrink. I don't want to see a hit doctor." But even taking that into account, there is an even heavier stigma attached to those who take medicine for like mental health. It's not just among it's not just among society. It's among the stigma is very much so among people who are having mental health issues as well, and that can be a bad thing, as you can imagine. Now, here's the thing. For just society-wise, just in society-wise, I was talking to a friend who I shall not name, and even for that person, if I say like something like, "Oh yeah, I go for therapy or what," and they'll just go like, "Oh yeah, you go for therapy, what?" It I hope that your therapist is like friendly or something, things like that. However, the minute I talk about saying that I take medication, especially antipsychotics, I really hate the name, by the way, antipsychotics, but that's the medical name for it. For those drugs, I wish they could just say like something like mood stabilizers, which they call them mood stabilizers and what. But sometimes when people just ask, "Are you on antipsychotics?" I say, please call them whatever else. I have to look up what they're called, but yeah. The minute people hear you're on antipsychotics, next question they say, "Oh, if you miss your medication, will you become a problem? Will it be a problem? Are you going to like start behaving very wildly?" And then I had to explain. I said like, my medication in particular is very long term, and missing 1 or 2 days doesn't cause a problem. But in any case, I've got pill boxes and stuff, so it's all laid out so I don't miss my medication. Da 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 da. But again, like, I had to explain myself, and that's also fair because yeah, this friend, like, I know him in other areas and stuff, but and it could have an effect on like various interactions. But let's just say that it's a fair concern, especially for a job for a job interview or something. People will be more likely to express concern if you say that you are on medication for mental health issues, rather than just if you say like, oh yeah, the order is something like, if you say you're going for counseling or just talking to someone, people are more like, oh, okay. If you use the word therapy, then you get a far larger eyebrow raised. Therapy. And if you say you're on medication, oh boy, that's a red flag. That is a red flag. So yeah, society-wise, that is the stigma attached. But even among people who have mental health issues, there's a clear stigma. A lot of people I talk to who are going through depression, they recognize that they are undergoing depression, and they just say, usually they'll just try and tough it out. Maybe they are willing to talk to friends. If that's how bad the stigma is. Even something as simple as talking to friends about how you're feeling depressed has a stigma attached to it. A lot of people don't want to do it, but yeah, that's the second most. Third most would be like, they say, fine, I'll go get professional help, talk to someone. Or no, sorry. Third step is they would go to a free service, say Befrienders or one of those like depression hotlines, because those are anonymous and free. So they are a lot more accessible than 4, which is the paid professional services. Not again, sorry. Anyhow, personally, I would say the advantages of the paid professional services are they tend to be better, again, depending on the person you meet, because sometimes there's different levels of skill and there's just different levels of compatibility. Someone who clicks well with you might not click with someone else. It's so on and so forth. But yeah, anyhow, 4th on that list would be professional therapy, professional counseling, and the 5th one that people try and avoid very much is medication. The most common of all being like one of the most common. Sorry, I don't know how common it is, but Prozac's pretty common. It's a household name. You say, oh yeah, I'm on antidepressants, I'm on Prozac. People are like, oh okay, yeah, I know that. So, in fact, because Prozac has become such a household name, the stigma has gone down a fair bit. People are a bit like, oh yeah, Prozac. I know a person who knows a person who takes Prozac for their depression. So in a sense, the more common it is, the less stigma is attached to it. The minute you start mentioning drugs with long names that people don't know of, they start getting a bit worried. Actually, there is a 5th option, which is very rare, which is neurosurgery, but I know nothing about that. I shall not go into that. And yeah, I know nothing about neurosurgery and how it applies, so I'm just going to skip that entire topic. Hopefully someone who knows more can educate me about that. But going on about the subject of medication again. As far as whether someone should be on psychiatric drugs or not, that's actually best not decided by the patient themselves. I know it sounds like it should be your choice, but honestly, you're not a doctor. I'm not a doctor, so I'm not advising you either. What I'm saying is that it's probably best to go to an actual psychiatrist and then get yourself diagnosed, and then they can tell you whether like your best option is to get therapy or to get medication or whatever. And yeah, the trouble is here is also that if you choose to go to a psychologist, psychologists do not prescribe drugs, and a psychologist will be just giving you therapy. And if you express that you do not want to see a psychiatrist or take drugs, they'll usually just keep keeping you on therapy, because there is some level of trying to respect the patient's wishes or preferences, or to be honest, sometimes they just don't want to piss off the patient, because sometimes people can be stubborn, right? If someone is dead set on, I do not want to take psychiatric drugs, then well, what are you gonna do, right? You gotta argue with them? No. So you just leave them be. But yeah, so if you start off with a psychiatrist, they will usually try their best to evaluate you and determine whether you need drugs or not. If you have started off trying to avoid drugs and go to a psychologist instead, you can there's a chance that you might not be referred to a psychiatrist, and that might be a pity, because in many cases, depending on your neurochemical structure in your brain, again, not a doctor, again, I'm not a doctor, so I don't can't explain the exact science, but I do know that there is often like just different brain chemistry. So sometimes for depression, I mean, there are normal people who get depressed, who that's external factors, and then there's people with chemical imbalances like me, who are just I need medication to regulate the whole chemical balance stuffy thing or something. In any case, for me, it's not so much due to external causes. I can just get depressed out of nowhere, or I can get like a bit high out of nowhere. It's not quite like Bob from Thunderbolts. Maybe a bit similar. Bob from Thunderbolts most likely has bipolar depression, actually. But that's neither here nor there. But or maybe it is. Maybe it is here and there, because again, there's a lot of stigma attached to mental health issues, and I am quite happy that Marvel put in someone with mental health issues, and instead of turning them into like an irredeemable villain, they solved it like in the Disney manner by he gets friendship, love, support, and then everyone has a happy ending, which is really, hopefully, what can happen. So anyhow, my point being that I digressed. Sometimes there are people who just have different brain structures, and medication would just help them live a normal life. It's like people with diabetes who don't generate enough insulin. If you give them insulin, oh, suddenly they can live normally. To some level, similar to insulin, there's like some level of there's some level of a gray area, because you get people who are not quite fully in the needing medication, but they're like a bit like prone to depression, and then you're like, do I prescribe them on antidepressants or not? And again, not my call, not my advice. I'm not a doctor, I'm not a psychologist, I'm not a psychiatrist, not my call. But yeah, I'm just saying that for some people, me for example, I was going through a lot of very tough years with bipolar depression because of like neurological reasons, and also like tough things were going on in my life. And after being put on medication, I'm like, okay, things become so much easier. It's not that I never get depressed, or I never get sad, or I never get especially happy. It's just that without the medications, it's a huge uphill battle. It's like, honestly, even people without mental health issues get depressed, because sometimes life is rough. It's just that if you have some whatever chemical imbalances in your brain, then things just get so much worse. It's like it is such a bigger uphill battle, right? So at least with medication, you can fight on an level playing field, so to speak. And that's why I'm saying, I wish that the stigma towards psychiatric drugs wasn't so steep, so big, because yeah, it really is. And and I feel that psychiatric drugs can really make a difference. They can be a game changer. Again, effectiveness depends from person to person. Sometimes, you're gonna be on those drugs, they say, oh, they're useless. And some people say, like, oh, they're the greatest thing ever. And there's so many types of them out there. And honestly, some people just go on, like for me, my testimony, my experience, I went for like many years on just Prozac alone, not so effective. Then they added olanzapine to the mix, and that was really good. But olanzapine causes weight gain, and then there were like ups and downs in my life, so my dosage got adjusted for this. Sometimes up, sometimes added Prozac, sometimes lowered the Prozac, sometimes the olanzapine went up, sometimes the olanzapine went down. And now, because olanzapine causes weight gain, I've switched to a different drug, which I can't remember the name of instead. And that's considered a success story. For a lot of people, they are going to be given drugs and then they say like, oh, this isn't working. And for me, step one, option A didn't work, but option B did work, albeit not so great. It still took a lot of many years of fine-tuning the dosages in order to get to it, and even then, I'm still changing it up to today after several decades. There is still fine-tuning. So for a lot of people, they are going to say, start on psychiatric drugs, and option A might not work. Then they go option B. They try option B. Option B might not work. They might try option C. Option C might not work. And then they start to get really sick and tired of things. And then they might just give up. But you never know whether option D is the one which finally works. That's the sickening thing. And a lot of these things are long term, so you have to continue on a certain prescription for like weeks, months or something, and then they say, oh, you know what, I thought it would work, but it didn't work after all. And that sucks. That would suck, right? It does suck, let me tell you. So I want to say, for those of you who do not have mental health issues, yeah, be kind to those who do need help, whether it be like just a friendly pat on the shoulder, or whether it be therapy, or whether it be medication. Because, yeah, just making, I have always appreciated when someone just makes my day slightly brighter. Even just one and kind gesture is enough to make my day brighter. That counts. It does count. I am grateful. And for those who are facing mental health issues, honestly, you know what? I would like to say just ignore all the stigma attached, but that's not easy, is it? It honestly, because you have to be concerned not just about society, but whether it's going to impact your education prospects, your job prospects. Yeah, whether employers are just going to look at your health record and say like, oh, this guy has mental health issues, let's not hire him. But I don't know, for me, I see a lot of people who just say, you know, maybe I can get by without it, maybe it's not so bad, maybe I can push on and do without, because really a lot of people just don't want to dirty their medical records. But you're not a doctor, I'm not a doctor, so really the best thing to do is just go to a actual doctor and get them to tell you the truth, whether you let the doctor make the decision whether you need actual help, or whether you can just whether you can just tough it out. Because as I said, you're not a doctor, I'm not a doctor. you're not a doctor, I'm not a doctor. The decision whether to get professional help or not should be left to the doctor. And that's because the consequences of untreated mental health issues can be devastating. And even if they're not devastating, your quality of life suffers, honestly. I mean, I know people who are undergoing depression and they are toughing it out. They are toughing it out. They're working day to day. They are living, making a living. But honestly, are they happy? Are they are like so unhappy from their depression and stuff. I mean, they have their ups and downs, but they're generally so unhappy. And I know some people who like they start on medication and then they're like, hey, wait a minute. It's like I'm so much happier nowadays compared to previously. And I'm like, yeah, it's like there are times when you can, get by without medication or without therapy or whatever, but it's sort of not worth it because you can get by, but you're struggling day by day, and just like your quality of life is just shit. And then for some people, mind you, but quite a lot of people, they get professional help, and then they find that their quality of life just improves a lot. And then it's I won't lie. In my country and in a lot of countries, mental health care is expensive. It's like therapy sessions, expensive. Medications, expensive. And a lot of these are like, you have to go and see them quite regularly too. So it's like the expenses can pile up. So again, it is, it might not be an option for everyone. It is what it is, sadly. But yeah, I'm just encouraging those who are having a hard time to try and check out what options are available to them, and don't be shy to just reach out for help. And if you feel that things might be really hard, or if even the possibility occurs to you that maybe your life could get better if you like were to get professional help, then yeah, do consider it. And again, for those who happen to know people who are facing mental health issues, oh, I sympathize with you. Again, I know that I can be a bit of a pain, and I'm not even considered all that bad. A lot of children especially are just so badly behaved. Well, there's a lot of badly behaved adults too who have mental health issues, and they cause big problems. And I would ask you to put up with all that shit, because no one should need to put up with all that shit. Maybe all those, if they're really bad, you can just avoid them, or but if you can, maybe you can like just tell them that it's okay to seek help, because I don't know. I wish I wish when I was really young, I wish someone had like just done that for me, told me that it's okay to get help. And again, because of the stigma, even when I wanted to get help, my father was unwilling to do so because it would affect my medical records, my scholastic records, my future employment prospects and stuff. And yeah, so I'm a bit sensitive when it comes to matters involving the social stigma of mental health. And probably I've rambled long enough. And thank you everyone who's like tuned in and listened to me. It is much appreciated because um, to be honest, half of this is to help raise awareness, and a lot of it was like just me getting stuff off my chest that I have been keeping pent up, or that I want to speak about. And thank you very much for listening to me. It means the world, and I'm looking forward to the day when we move forward and mental health care just progresses further in my country and in others too. And this is Jason Red 79 signing off. Bye bye.